You're measuring blood pressure wrong. 11 mistakes most seniors make. Have you ever looked at your blood pressure reading and wondered if that number is actually telling the truth? What if I told you that millions of adults over 60 are being scared by blood pressure numbers that aren't real, while others are walking around with dangerous hypertension and don't even know it? Today, I'm going to reveal 11 surprisingly common mistakes that can completely change your blood pressure reading, sometimes by 10, 15, even 30 points. And here's the scary part. Many of these mistakes happen inside doctors' offices every single day. So before you trust your next reading, stay with me until the end, because the final mistake could determine whether you're being treated for a condition you don't actually have, or missing one that could lead to a heart attack or stroke. Before we begin, if your goal is to stay healthy, independent, and active well into your 70s, 80s, and beyond, take a second to subscribe to the channel. Every week, I share practical, science-based health advice specifically designed for adults over 60. No hype, no miracle cures, just the information I wish every patient knew before problems started. And while you're down there, leave a comment with your age and where you're watching from. I read your comments every day, and they help me decide what videos to create next. Now let's talk about something almost nobody explains properly. Most people think blood pressure is a fixed number. They believe they have one blood pressure, one true reading, one score. But that's not how blood pressure works. Blood pressure is constantly changing. Every minute, every hour, every day. It changes when you walk, when you're stressed, when you're worried, when you're excited, and even depending on where your arm is resting. Over the last 15 years working with older adults, I've learned that most people don't have a blood pressure problem, they have a blood pressure measurement problem. And that's a very important distinction, because if the measurement is wrong, every decision that follows can also be wrong. Wrong diagnosis, wrong treatment, wrong medication. Everything begins with an accurate number. Several years ago, a woman came to see me. Let's call her Margaret. Margaret was 68 years old. She exercised regularly, maintained a healthy weight, slept well, and followed every recommendation her doctors gave her. Yet every time she visited a clinic, her blood pressure was high. Eventually, a second medication was added. Then she began feeling dizzy, weak, and unsteady. One afternoon, she nearly fell in her kitchen. When we asked her to measure properly at home, her average blood pressure wasn't 160/95. It was 128/78. Completely different. Her blood pressure wasn't the problem. The measurements were. That is exactly why this video matters. Because by the end of the next few minutes, you'll know how to separate a real blood pressure reading from a phantom one. Mistake number 1. Taking your blood pressure too soon after sitting down. This is, without question, the most common mistake I see. You walk into a doctor's office, get called back, answer questions, sit down, and 30 seconds later a cuff is wrapped around your arm. But your body doesn't instantly switch from activity mode to resting mode. Your heart is still recovering. Your blood vessels are still adjusting. Research shows that failing to rest properly before a blood pressure measurement can increase systolic pressure by approximately 10 to 11 points. Imagine your true reading is 128. Add 11 points and suddenly you're looking at 139. Same heart, same arteries, different conclusion. This is why blood pressure guidelines recommend sitting quietly for at least 5 full minutes before measurement. No phone, no texting, no scrolling, just quiet rest. Mistake number 2. Talking during the reading. Have you ever noticed what happens while the cuff is inflating? Someone asks a question. How have you been feeling? How's your family? Did you find parking okay? It seems harmless, but talking changes your breathing pattern, activates muscles in your chest and throat, and stimulates your nervous system. Studies repeatedly show that conversation during measurement can increase systolic pressure by around 7 points. Combine that with the first mistake and you're already 18 points above reality. The solution is simple. When the cuff starts inflating, remain completely silent until the measurement is finished. Mistake number 3. Sitting without proper back support. Your body is incredibly efficient. Whenever a muscle works, even slightly, your cardiovascular system responds. That's exactly what happens when you sit without back support. Your muscles must constantly engage to keep your torso upright. Even though it doesn't feel like exercise, your body recognizes it as effort. Research suggests an unsupported back can increase systolic pressure by approximately 10 points. Sit in a firm chair with your back fully supported and allow the chair, not your muscles, to hold you upright. Mistake number 4. Letting your arm hang too low. This mistake has nothing to do with stress. It's pure physics. Gravity. When your arm hangs below heart level, gravity increases pressure inside the blood vessels of that arm. As a result, the monitor records a number that's higher than your actual blood pressure. An arm position too low can increase systolic pressure by around 6 points. The correct position is simple. Support your arm on a table or pillow and keep the center of the cuff level with the center of your chest. Mistake number 5. Crossing your legs. This one surprises almost everyone because crossing your legs feels comfortable and natural. But during a blood pressure reading, it can significantly distort the result. Crossing your legs partially compresses large blood vessels in your thighs and pelvis. Blood flow encounters resistance, pressure builds, and your blood pressure temporarily rises. Research suggests crossing your legs can increase systolic pressure by as much as 15 points. Imagine your true blood pressure is 125. Cross your legs and suddenly the machine may show 140. The ideal setup is simple. Back supported, feet flat on the floor, legs uncrossed, arms supported at heart level, quiet breathing, and 5 minutes of rest. Mistake number 6. Measuring with a full bladder. If someone had told me this early in my medical career, I probably would have been surprised too. What does your bladder have to do with blood pressure? Quite a lot. When your bladder becomes full, your body interprets it as a low-level stress signal. The nervous system responds, stress hormones increase, blood vessels constrict, and blood pressure rises. Studies have shown that a full bladder can increase blood pressure by up to 15 points. Think about how often people check their blood pressure first thing in the morning when their bladder is at its fullest point of the day. The solution couldn't be easier. Use the bathroom first, then sit quietly, then take the measurement. Mistake number 7. Measuring too soon after coffee. I know what some of you are thinking. Doctor, don't tell me I have to give up my coffee. Good news, you don't. In fact, I wouldn't recommend it for most people. But timing matters. Caffeine temporarily stimulates the cardiovascular system. For people who rarely consume caffeine, the effect can be surprisingly large. A single cup of coffee may increase systolic pressure by around 10 points. Sometimes more. Now here's where things get interesting. People who drink coffee every day often develop tolerance. Their bodies adapt. As a result, caffeine may have little effect on their blood pressure. But because everyone's response is different, the safest approach is consistency. Don't suddenly skip your morning coffee if you drink it every day. That can create withdrawal symptoms, and headaches can raise blood pressure too. Instead, maintain your normal routine and simply wait about 30 minutes after coffee before checking your blood pressure. The same advice applies to tea, energy drinks, caffeinated soda, and nicotine. Nicotine is particularly powerful. Even a single cigarette can temporarily raise blood pressure and heart rate. Mistake number 8. Using the wrong cuff size. Most people never think about cuff size. They assume one cuff fits everyone. Unfortunately, that's not true. The cuff must match the size of your arm. When a cuff is too small, it has to squeeze harder to compress the artery. The monitor interprets that extra force as higher blood pressure. The result is a falsely elevated reading, sometimes by 10 or 11 points. But the opposite problem can also occur. If the cuff is too large, blood pressure may appear lower than reality. In many ways, that's even more dangerous because a falsely low reading creates false reassurance. I once worked with a gentleman in his early 70s who purchased a home monitor online. Every reading looked excellent, almost too excellent. When we checked his arm size, we discovered he was using a cuff designed for much larger arms. His actual blood pressure was nearly 15 points higher than what he had been seeing at home. That's why cuff size matters. Take a measuring tape, measure the circumference of your upper arm, and compare it to the size range printed on your cuff. It's a one-time task that can dramatically improve accuracy. Mistake number 9. Using the wrong arm. Most people assume blood pressure is the same in both arms. In reality, your left and right arms often produce slightly different readings. A difference of a few points is completely normal. But when the difference becomes larger, it may be telling us something much more important. Imagine a garden hose. If part of that hose becomes narrowed, less water can flow through it. The same thing can happen inside your arteries. One of the major blood vessels supplying the arm can gradually narrow over time. When that happens, blood pressure measurements may differ significantly between arms. This is why I tell every patient to check both arms when they first begin home monitoring. Measure one arm, wait a minute, then measure the other. Do this several times over a few days and compare the averages. If one arm consistently reads 10 points higher than the other or more, that's worth discussing with your doctor. Once you've identified which arm consistently measures higher, that's usually the arm you should continue using for future measurements because it provides the most accurate picture of the pressure your cardiovascular system is working against. Mistake number 10. Trusting the wrong device. A blood pressure reading is only as reliable as the device producing it. Unfortunately, not all monitors are created equal. Walk through an online marketplace and you'll find hundreds of options. Some are excellent. Others have never been properly tested. The biggest issue I see involves wrist monitors. I understand why they're popular. They're convenient, easy to travel with, and easy to put on. But convenience doesn't always equal accuracy. Your wrist contains smaller blood vessels than your upper arm and is extremely sensitive to positioning. Move your wrist slightly too high and the reading changes. Move it slightly too low and the reading changes again. That's why professional organizations generally recommend upper arm monitors whenever possible. An upper arm monitor is simply more reliable, more consistent, and less vulnerable to positioning mistakes. Before purchasing a monitor, make sure it has been independently validated and tested for accuracy. A validated monitor gives you confidence that the number you're seeing actually reflects reality. And now we've arrived at the final mistake. The one I consider the most important and the one that has probably affected more people than all the others combined. Mistake number 11. Relying only on readings taken in a doctor's office. This final mistake hides two conditions that are mirror images of each other. One can lead to unnecessary treatment. The other can hide a serious cardiovascular risk for years. Let's start with the first, white coat hypertension. For some individuals, simply entering a medical environment triggers a stress response. The waiting room, the examination room, the anticipation, the uncertainty. Even when they feel calm, their nervous system reacts. Heart rate increases. Blood vessels tighten. Blood pressure rises. Research suggests white coat hypertension may increase systolic pressure by as much as 30 points. Imagine your true blood pressure at home is 128. Add 30 points and suddenly you're staring at a reading of 158. That's the difference between reassurance and alarm. Margaret, the patient I mentioned earlier, was a perfect example. Every office visit produced high readings. Her doctors became increasingly concerned and eventually another blood pressure medication was added. Then the dizziness started. She felt weak standing up. She became unsteady walking across the room. One afternoon she nearly fell while preparing lunch. When we asked her to measure properly at home using everything we've discussed today, her average wasn't 158/94. It was 128/78. The office readings had been creating a phantom number. Once her treatment was adjusted, the dizziness disappeared and her confidence returned. But now let's talk about the opposite problem because in many ways it's even more dangerous. Masked hypertension. This occurs when blood pressure looks normal in the doctor's office but remains elevated throughout everyday life, at home, at work, and during daily activities. The office reading reassures everyone. The patient feels fine. The doctor feels reassured. No treatment is started. Meanwhile, elevated blood pressure continues damaging arteries quietly in the background month after month and year after year. That's what makes masked hypertension so dangerous. It hides in plain sight. This is why home monitoring is so important. Not because office readings are useless, but because they only capture a tiny snapshot of your life. One moment, one location, one day. Your true blood pressure story unfolds across weeks, months, and years. Which brings us to the most important takeaway from today's video. If you remember only one thing, remember this: never obsess over a single blood pressure reading. Everyone has occasional spikes. Stress happens. Poor sleep happens. Illness happens. Life happens. What matters is the average, the trend, the pattern. That's what predicts risk. That's what guides treatment. Here's the protocol I recommend to my patients. For 1 week, take 2 readings in the morning before coffee and before medications. Wait 1 minute and take a second reading. Then repeat the process in the evening before bed. Do this every day for 7 days and record the results. At the end of the week, calculate the average. That average is far more meaningful than any single measurement. If your average home blood pressure remains consistently above 130/80, that's the time to have a conversation with your healthcare provider. Before we finish, I want to give you one bonus lesson that may be even more valuable than anything we've covered so far. Most people don't actually have a blood pressure problem. They have a blood pressure anxiety problem. Have you ever checked your blood pressure, seen a high number, become worried, checked it again, and watched it climb even higher? I've seen this happen countless times. Some people become so focused on chasing perfect blood pressure readings that they accidentally create the very stress that raises their blood pressure. Blood pressure is not a test you pass or fail. It's information. One high reading does not mean you're having a stroke. One normal reading does not mean you're immune to heart disease. It's simply one piece of information. Think of blood pressure like the weather. One hot day doesn't mean summer has arrived. One cold day doesn't mean winter is coming. You look at patterns over time. Blood pressure works exactly the same way. That's why home monitoring is so powerful. You're no longer reacting emotionally to a single number. You're observing a pattern and discovering the truth. Now there's one final question I get almost every week. Dr. David, what is the single best thing I can do naturally to lower my blood pressure? While there isn't one magic solution, there is one habit that consistently produces remarkable results. Walking. Simple walking. Not running. Not intense workouts. Just walking. A brisk 30-minute walk most days of the week can significantly improve blood pressure, circulation, heart health, blood sugar control, mood, and even brain function. Some studies show regular walking can reduce blood pressure almost as effectively as a single medication in certain individuals. If you're looking for somewhere to start there. Take a walk after breakfast. Take a walk after dinner. Invite your spouse. Invite a friend. Just move. Your heart will thank you. Before you go, let's quickly review today's 11 mistakes. Not resting before measurement, talking during the reading, sitting without back support, allowing your arm to hang too low, crossing your legs, using a full bladder, checking too soon after caffeine or nicotine, using the wrong cuff size, using the wrong arm, trusting inaccurate devices, and relying only on office readings. Fix those mistakes and you'll immediately improve the quality of every blood pressure reading you take for the rest of your life. And remember, don't chase perfect numbers. Chase accurate numbers. Because accurate numbers lead to better decisions. Better decisions lead to better health. And better health leads to more years doing the things you love with the people you love. If you've stayed with me all the way to the end, I have a small favor to ask. Leave a comment below and tell me, which of these 11 mistakes surprised you the most? Was it crossing your legs? Using a full bladder? Or discovering that your blood pressure may be different in each arm? I read every comment, and your answers help me create future videos that address the questions real people are asking. If this video helped you, please subscribe, turn on notifications, and share it with someone who checks their blood pressure regularly. It could help them avoid years of unnecessary worry and potentially prevent a serious health problem. Thank you for spending this time with me today. Take care of yourself. Take care of your heart. Stay healthy. Stay strong. And I'll see you in the next video.